Hi Vinas, hope you're doing great. So I'm back again for the next part of your NEET MDS 2025 recall. The main motto of this recall is to provide you the exact source where the questions are coming from, either from the app or from the website of Mdsconquer, so that you can plan your preparation and prioritize the things accordingly. Okay, right? So Cello, let's jump into the questions what were given in the examination. The first question was a patient with a long-standing, completely edentulous arches. There is a continuous mandibular ridge resorption that leads to which of the following. So this particularly comes under the topic of ACE changes, which was discussed by Akshay sir in his video. So ACE change concept is very, very important. Why I'm stressing it is very, very important. Reason is there was a question in 2024 on this particular concept, and similar question was repeated in 2025 NEET examination also. What is the question which is given in 2024? It is about the mental foramen position. And you check out the same question was given. The concept was given. Option C is the right answer. It's basically due to the mental foramen, which is located near to the crust of the ridge. Okay, where we are keeping more pressure. And if you check out the website, okay, so GT number 16, there was a question, a complete denture wearing patient complains of tingling sensation in the lower premolar region, and the ridges are resorbed, and most probable explanation for this is the answer is B, that is pressure on the mental foramen due to the ridge resorption, right? Similarly, if you check out the GT5, so I have given a question on ACE changes related to the mandible from the infancy to that of the old age. If you check out the explanation part, I have clearly given ACE changes, what happens in the infant, what happens in the adult, what happens in the old individual. And this is a line where the question of 2025 NEET came. And of course, this was discussed so many times on your WhatsApp. Okay. And of course, 5 days, 10 days before exam also, the same concept was being discussed and stressed. Okay. And I hope you guys have marked it right. The next question, which of the following rest will eliminate the need for the placement of clasp arm buccally? So whenever you want to eliminate placing buccally, lingually, or any sort of extensions you want to eliminate, you have to place it very center to the center of rotations, long axis of the teeth, by which the only option that is inclined is option A, whereas rest other options are moving away from the center. And if you ask me the exact concept in the form of a question, yes, it was available on your website in your AIIMS SRship papers. What is the question? The main advantage of giving an internal rest seat is to eliminate the visible clasp arms, option C. Okay, right. So I'm jumping into the next question. Again, one more question on rest. In designing of a rest for a mandibular teeth, the marginal ridge is reduced by 1.5 to 2 millimeters. All these dimensions and everything we have discussed. And in such conditions, you are going for rounding the particular line angles. Normally, we don't give a sharp line angles. The reason is sharp line angles will lead to decreasing in the thickness. Inadequate thickness will be there. So whenever your metal is in inadequate thickness, there is a high chance that the metal is going to fracture. So that is a basic concept. And this concept was discussed by Sir in his slide. So whenever you're going for rests and rest seat preparations, make sure you have to go for adequate thickness at that particular area. The reason for your going for an adequate thickness at that particular area is without adequate thickness, there is a high chance of fracture of this particular condition. And of course, rests and rest seats are very frequently asked in INICET compared to the NEET exam. If you check out the question which was given, which was the question that is given in your INICET June 2020 on the website. Okay, so which of these is true about the rest seat? Okay, so in the explanation part, each and every line was covered straight away from your standard textbook. The forms of your rest seats, thicknesses, why you give this, what are the angles you give, and everything. Okay, so I hope you guys have handled logically, okay, to solve this particular question. So jumping into the next question, contraindication of resin bonded fixed partial denture. Of course, SAR has covered, and even I have covered in the bootcamp series in the offline. So all the points related to that of the fixed partial denture, resin bonded fixed partial denture, and 3 types of resin bonded fixed partial denture, which are important from the examination point of view. All the highlighted points were covered repeatedly for you. So now the question is about the contraindication of a resin bonded fixed partial denture. The answer is deep bite, option B. If you check out the class, okay, clearly mentioned resin bonded processes, contraindication, clearly given deep vertical overlapping. In such case, it is contraindicated, which is nothing but called as a deep bite. Next comes to the next question, the minimum distance between the two implants. The minimum distance between the two implants, very frequently, even it is discussed in the last few days on the group also. Okay, so minimum distance is 3 millimeters. I don't want to waste your time. Option B, straight away, so many times repeated in the exam. Again, one more question on implants. A 50-year-old well-controlled diabetic patient requires an implant in the posterior mandibular area. The most important factor to be considered in these individuals is, of course, we take CBCT to evaluate the bone densities, more often a common sense and a clinical based question. Of course, densities, classifications, and all these things, like which is the ideal density, because all these things are very constantly repeated and discussed to you, and I hope you have managed this application based question. Then comes one more tricky question. Most of us are not aware of this, not exposed properly. So which muscle causes powerful strokes? Options sounds to be a little cool and composed. But if you check out the videos of mandibular fractures, ma'am has clearly discussed the primary muscles, secondary muscles, and accessory muscles. In primary muscles, she has stressed more about temporalis and masseter. Okay, because temporalis is basically causing fractures. Whenever it is overstressed, whenever it is overstretched or overcontracted, there is a chance of fracture, assuming that this is a muscle, their angulation, their fibers, their orientation, the area of contact, the muscle size, the muscle density, and everything are logically related to the answer of temporalis, option D. But if we go deep into the website questions, so it is given in your INICET mock, and the same question was repeated in your dental anatomy subject specific exam. What is this question? It's basically dental anatomy question. During chewing, electromyographic activity of temporalis and masseter were taken. Electromyographic activity of temporalis and masseter muscles lasts for a mean value of, okay, means highest point when they are going to reach and how much time they are going to last, and why we are talking very specifically about temporalis and masseter compared to other masticator muscles. These are hitting the highest values. That's what the explanation part that is given, and I hope logically or basing upon the diagram, whatever you remember, muscles of mastication, I always told you to remember the diagram. So you see, it's the density, the surface area of temporalis is max. Whenever it is maximum, the muscle is in maximum size, it's going to cause the maximum strokes. Okay, right? So I hope you have marked option D, temporalis. Yeah, trismus. Okay, a number of times. I think throughout the year it was discussed more than 50 times on WhatsApp itself, and of course given so many times in the exam. Straight away the answer is median pterygoid without any doubt. Again, this question was given in the mocks. Okay, GT22 it was given. So answer is median pterygoid. 5 days before exam also, I think I have discussed this in the voice note format, and I hope you guys have not marked wrong. Okay, right? So chalo, I'm jumping into the next question. Yeah, Kennedy's classification. I told you so much about Kennedy's classification. Must to be done. Kennedy's classification, Applegate's must to be done in the last 10 days. Yeah, you have class 3 and they're asking the nature of support of class 3. Yes, it is tooth bone. Very good, very right. So if you check out the class also, actually sir clearly mentioned when you're talking about class 3, clearly mentioned tooth support. It straight away he has written with his hand. Okay, and of course it's a very common and easy question, and I hope you have marked it right. Then jumping into the next question, a 50-year-old male patient with a missing teeth, maxilla, so missing on the left and missing on the right, so bilateral edentulous. Again, Kennedy's. If you know Kennedy's, of course, if you go through the options, I think you can easily handle this particular question. Okay, right? So bilateral edentulous space is going to come under class 1. And if you check out clearly mentioned either unilateral or bilateral edentulous case, okay, so you are going to go for your selective pressure technique, which was not there in the options. Okay, then you have to go for the type of cast what you are going to prepare, that is basically called as altered cast technique. And of course in GT10 you have a question, what is this altered cast technique is basically used in? Altered cast technique is basically used in the case of class 2 and class 1 and class 2 edentulous spaces. Okay, here the answer is B. Here the description is given about class 1. The answer is altered cast technique, option B, without any doubt. Okay, right? So I hope this particular sessions, a series of sessions are useful, mainly to improve the confidence. Okay, of course, anyway, the result will be coming in a couple of days. So people who are already given 2025 are less concerned about what is going to happen with the recall, according to me. Okay, but these videos will be uploaded on your app for 2026 batch. So check out where the questions are coming. Okay, PYQs is one important thing to be addressed. It's not only the exact PYQ. It's not only the exact PYQs. It's PYQ concepts also, which are well covered and organizedly covered in the case of bootcamp series. Bootcamp series videos also access I have given to 2026 batch students. So make sure don't miss bootcamp. Don't wait for the bootcamp of 2026. Okay, so bootcamp series folder of 2024-25 was given to you already. So make sure I want you to start. 2026 students, please do start this bootcamp series. Don't wait for your bootcamp. Your bootcamp will be in the last 3 months. When it is going to be in the last 3 months, that will be falling under the folder of 2025-2026 bootcamp. So last year bootcamp, your seniors was given 10 days, exam 10 days back. Those bootcamp access was given. So please do start it now, because there is a high chance that these PYQ concepts will be coming in your exam too. And that is the reason why these are all well covered. Short videos of 2.5 hours for each subject, covering the major aspects. So please try to do this bootcamp ahead. Don't wait for the last 2 to 3 months. That is the main motto why I'm stressing bootcamps are important. QBank is important. All previous year questions were covered in the QBank. So please don't neglect QBank. Please try to do it. Then we have recently started one more thing on your QBank only. In the QBank only, you will be having something called as PYQ. So that we have given a tagline of late night PYQs. Late night PYQs. Every day, late night, before you're going to bed. Every day, 30 minutes, you do some PYQs. So late night PYQs will be available subject wise. It's not like overall. So it will be available as a subject wise in your QBank folder. Okay, so I hope like QBank is there. You're opening QBank. So you have a subject like, for example, pedo QBank. In pedo QBank, apart from all the topics of pedo QBank, the last 5 to 10 QBanks will be PYQs. So late night, every day late night, you can do PYQ QBanks. Okay, so late night QBanks, you can do it, and no one is going to check your scores. Okay, so please, because we have a phobia, no one is going to check your scores. PYQs, no one is going to analyze your scores. You are going to see the scores, you are going to see the question. So don't waste time. So please make it a habit that every day you're going to solve PYQs. So that's what I'm implementing for 2026 batch. For more details of the courses, everything XYZ, you can ping to this particular number 9966939317 for all details. And make sure before you join also, I strongly recommend in Mdsconquer particularly, I'm not aware of other areas how it is happening. So in Mdsconquer, if you are not clear with anything before you join, make sure you request this particular number to have a pre-preparation talk. So we are providing a pre-preparation talk, analyzing what you are intern, okay, from which college, how the OP is, how your previous reading patterns are, if you're a repeater, how your approach. So approach of a repeater should be different from an approach of an intern. Approach of an intern posted in a college with more OP is slightly different from approach of an intern posted in a college with less OP. Mother has to prepare in a different pattern. So reading patterns or resource patterns cannot be same for all of you. Okay, right? So it varies from individual to individual, basing upon which I have segregated the people into two patterns, pattern 1 and pattern 2, which I have covered a video which was uploaded yesterday on the YouTube live. Okay, so you can check it. If required, I'll be dropping you the link of that particular video in the description part of this video. You can check it out. So that is very, very important for the people who are particularly planning to prepare. And of course, again, let it be a first year or second year or third year, final year is planning to prepare for the exam. their approach of reading should be different. It should not be like the people who are going to give an exam in the next 10 months. Okay, so all these are very, very important to be successful in the entrance exam with a minimalistic preparation. Everyone cannot be topper on the day of result. State topper, state top 10 will be only 10. Country top 100 or top 200 or top 300 will be 300 individuals only. But once you change your approach, you can be, or you are eligible to become a topper. So first, the eligibility criteria is more important. So what you read, how you approach, how you modify yourselves are more important. So then whatever you know, whatever you have done, you have to apply in the examination hall to come out with a great result. And I hope this video or this recall is very, very useful for most of you. Okay, so we'll see you again very, very soon for the part 10. Signing off, Dr. Srikanth from Team MDS CONQUER.